Hi, good morning. Good morning, everybody. We are back today. Uh, this is the show on COVID-19. I am your host, Moda Ruga, and today our panelists are Dr. Marcelina, Dr. Ferdinand Lally. We've got a guest visitor by the name Caesar Foley. I would like to apologize in advance that we might experience connection difficulties because he's calling from South Sudan. And if that happens, please bear with us. Our other panelist will join us later on, and that is Mr. Rodrigo Edema. We're going to start with a short prayer, and let's go ahead. Heavenly Father, we thank you this morning for this beautiful day. We thank you for the gift of life. We thank everybody out there listening to us. Father, fill our hearts and minds with wisdom so that whatever information we pass to these people will be beneficial to them. But we ask you to bless the week that we are entering in. Bless our thoughts and bless our deeds. Through Christ I pray. Amen. We'll start with a briefing from Dr. Marcelina on the second lockdown. What is it like? Is it going to happen? And if it happens, what is it going to be like? And so I would welcome Dr. Marcelina to brief us on the second lockdown. Thank you.
Greetings, everybody, from wherever you are. I welcome you all on this show, all viewers and the panelists. Before I get to the second lockdown, what it's going to be like, let me briefly say or discuss or explain what the lockdown is. In brief, lockdown is that situation where people are required to stay where they are due to specific risks. And in this case, it's the COVID-19 risk. And that risk is either to themselves or to others if they can move freely. The order restricts the society's movement and the services in the community or in that country. And that involves social distancing. And in this country, it's the 2 meters. And that also brings in play face masks. It also involves mass quarantining, or it may result in mass quarantining. The only allowed services would be essential services, such as businesses that deal with food or food stuff, and hospitals and healthcare services, just to mention a few. So now you may ask, what's the function or what's the aim of the lockdown? Two main aims. It is to slow the infection in the community and also to ease the pressure on the healthcare services of the nation or of the country. So, what are the determinants of a lockdown or a second lockdown if it were to come? So, that would be determined by a second wave of the COVID-19, or if there were to be spikes of infections in areas, various areas or towns. And the main thing would be, or the major thing would be, how the government would respond. In other words, the rapidity and the efficiency of the government's response, those infections, wherever they might spike. And that would include, of course, rapid testing in order to isolate the infections and to deal with that efficiently. Now, before I just come down to the nitty-gritty question, I just want to share an example of two cities or towns that locked down at various times. One of them is Lodi in Italy. It locked down or shut down on the 23rd of February. And then Bergamo shut down on the 8th of March. Outcomes of these countries or cities were different. Though Bergamo started with few cases, it overtook the city that locked earlier. And the outcome, of course, as you know, was that Bergamo infection rates were higher and death rates were even higher. So that tells you if you lock sooner, then you go on to save lives and the number of cases lessen. The other thing I want to talk about is Manaus, a city in Brazil. This is a case where you could say there was no lockdown. Any policies that were put in place were ignored, and there were over 1,300 cases per day earlier on. But in August, the cases came down to about 300. Excess deaths from about 120 came down to 0 by August. This city, apart from USA, was seeing diagnosis of 3,600,000 cases. 1,400, sorry, 1,000, I think I've lost my words today. Over 114,000 died. All of a sudden, in August, there were no deaths. The hospitals are closing down. So you would ask, what has happened? Is it collective immunity that happened? So just bear those in mind. Now we come back to the question that brought us here. Is there a second lockdown coming to our country, to our cities? So that's the kind of thought I want to provoke in you. Do you think it's likely we're going to have a second lockdown? And if we are, is it going to be regional lockdown? Is it going to be city by city, or is it a whole country? And if a lockdown will happen, what does lockdown mean to you? How is it going to affect you? So these questions I'm posing, not just to the panelists, I want you, the viewers, to also participate, because COVID-19 has come. It seems it's the new norm now, and it's affecting each and every one of us. So let us have these discussions. Thank you very much.
Well, thank you so much. Thank you, Dr. Marcelina. Caesar, have you got anything you'd like to tell us about the lockdown back there in South Sudan and Uganda? If you can hear us. Hello? I think we've got a problem.
It's just gone.
Yeah.
Let me try and fill in the meantime. Hopefully, he will come back soon. I should say thank you to Dr. Marcelina for that introduction. And I think just like lockdowns and all the other public health interventions, we will continue having conversations and redefining a lot of these terms from our experience. And I think I want to just start by using the example that these days when people talk about the first wave, second wave, and all of that, they remember a profile of, I think, the Spanish flu all those years back. And it is true that a population that is not prepared without a vaccine, without public health policies, if they're faced by an epidemic or a pandemic, probably in that very first wave, all the damage will be done. And probably there will be no second wave, especially if there is enough transmission in the population. You'll just have the one single wave. And those who survive it will be resilient. The clear thing about a second wave is this pandemic, and everywhere in the world, most governments actually took action very early. Because of public health interventions, the damage is limited. Of course, on the one hand, you protect the healthcare services, but also you protect the population. You can protect the population to the point you protect them almost in a way like you put them in a certain bubble, so they are not exposed to the disease. They will never have immunity until there is a vaccine or until they survive the disease. So this whole thing about the second wave is because, yes, we have intervened. The public health authorities have intervened to the point that people have been protected. But after you've been protected first time around, the thing is you have not been exposed to the disease. So when you unlock the population in terms of schools are going back, businesses are reopening, that exposure comes back. So those who have never had exposure with this disease, this is your first time. And you are the people who are probably going to experience the disease. So the idea of a second wave really has a lot to do with how effective the public health interventions were, to the point that they protected people. So as long as people have been protected, the potential of a second wave is there, unless you've got a vaccine. If you've got a vaccine, then people are protected using the vaccine. The other thing is that the first wave, because this is when lockdown was very effective in most countries and they enforced it, you know what, we're so different in our traditions, in our businesses, in our economies. So one of the biggest pressures, both in the developed countries to come out of lockdown and in the developing countries, is effectively you can't survive endlessly in lockdown without an economy. So we have to reopen the economy. And those pressures are very different. There are economies which are very centralized. There are economies which are very rural and maybe decentralized. And we talked previously about how differently a person will be affected if he's a farmer living in the rural population of Africa and a farmer in the UK, or somebody who works in the city. So the different characters of our economies are such that the pressures are very different about coming out of lockdown. So for those reasons, people come out of lockdown at different times. There are different policies about travel, and you'll imagine now in the UK we've got this bizarre situation where the constituent nations of the United Kingdom have different policies about people coming from the same country. Yet internally within the UK, you can travel anywhere without, I believe for now, any restriction. So for those reasons, we're going to be coming out of lockdown in very different ways. How effective our initial protection or public health guidelines protecting the population are different. And we're in a situation where the second wave is likely just about in any country. But they have to watch the numbers. They have to watch the way in which when children go back to school, when businesses reopen. And I'll give you the example of Uganda, for example. We were having primary elections and people were going in queues because that is the way people vote. We're going to have to watch very carefully because the effectiveness of the first lockdown opens the opportunity for a second wave. But how we will learn enough lessons and actually continue some of the social distancing and other measures like facial covering, if we have learned those lessons enough and continue a modicum of those guidelines, maybe just we will dampen the second wave. But immediately we start economic activity in schools, we should expect that the risk is increasing again. Hopefully we've learned enough from the very first wave, so-called, to be better prepared, because I think even Dr. Marcelina will understand the way in which the first cases were handled in the hospitals will have changed and thank God improved immensely. So when we have got a second wave, if we do, hopefully even the healthcare services are better prepared, both in capacity and the way in which they manage this condition. But we should be prepared that it will happen. Mm-hmm. And I would have liked that our colleague, our panelist from South Sudan was able to actually just give a few anecdotes of their experience, but hopefully from time to time when it comes in, at least if he listens to us and he types something, we will be able to get some contribution from him, because it's quite something that we should be able to interface with our people at home in South Sudan, in Uganda, and the rest of Africa to see how we can learn lessons, because I think the thing that is going to tell us apart from the developed countries in terms of a second wave is the pressure on the economy, because our economies are not quite centralized as here. Our economy involves a lot of those food hawkers on the streets, a lot of those people who travel across the borders, and a few of those who have got these big superstores or supermarkets in the capital cities. For those reasons, the behaviors of individuals will be so different about personal protection, about other guidelines for preventing the transmission of this disease. And hopefully, with that shadow from South Sudan, maybe we'll get something. But let's keep it going.
Let's see whether people come on. That would be very interesting.
Thank you so much. Caesar, are you able to give us talk to us about the situation back in South Sudan? Can you hear us?
Hello.
Yeah,
Yes,
can
we
you
can
hear
hear
us?
you.
Can you update us? Okay. Can you tell us about the situation in South Sudan and Uganda? And if you know there is a possibility of a second lockdown?
Oh, thank you so much. Yeah. Oh, yeah.
Hello? Yeah,
Thank
go
you
ahead.
very much, everyone.
Yeah.
However, the issue of network is a problem. Right now, I'm talking from inside South Sudan, in part of Eastern Equatorial State. However, some 2 weeks ago, I was in the border of South Sudan, bordering Uganda. That is called Nimule. The place is very busy. A lot of trucks in and out of South Sudan. However, what I've noticed and monitored and try to give you at least my experience about it is there, in most cases, I've noticed many people are ignorant about the issue of the COVID-19. However, the Ministry of Health and other humanitarian agencies, NGOs, are participating in awareness. I will just say more of effort needed to be guided. Particularly, women and girls are affected in that area. And I've noticed high teenage pregnancy taking place here in South Sudan, particularly in Eastern Equatorial State, where I've been. And due to lockdown, also there's a lot of forceful marriage in some traditional tribes act. And
Oh, I think we are losing
there
him
are some
again.
people locked down.
It's quite interesting, Chair. It's quite interesting. Maybe he will come back. I wondered whether he was relating teenage pregnancy to COVID. But it's quite interesting sociologically that we find, and I personally go back many years when I thought one of the things that caused the breakdown in family structure among refugees when we left Uganda and came to Southern Sudan was the fact that people arrived in drips and drabs. There were family members who arrived and crossed into Southern Sudan at different times. They had to become almost like self-sufficient, but the refugee camps were there. You were counted as an individual and given a food ration. And you know what that does? You get to a point where both girls and boys who should be minors, always depending on their parents, had a certain form of independence. And I felt, much as it was humanitarian aid, there was an element or a component to which it actually started to break down the family structure. And it is quite interesting that he's mentioning COVID in that context, where he's talking about teenage pregnancy. Teenage pregnancy, I cannot pretend I know exactly the basis, but actually there will be pressures to bear, and it would be quite interesting if you can expand on that.
He's back.
Yeah,
On the
Caesar, go ahead.
Go
Yeah,
on.
go ahead, please. Hello?
Caesar, you can go ahead.
just as he comes on, hopefully.
I hope you guys are hearing me very well.
Yes, go ahead.
Yes,
Yeah.
we are listening.
Are you listening to me?
Yes,
Yeah.
we are.
I think if you are listening to me, the network is not clear.
We are aware of that.
Well, your network is not okay to me. I'm not hearing fully
We can hear you clearly.
what you're
Go ahead.
saying.
We can hear you.
Yeah, go ahead. Go on, please.
Hello?
Yeah.
Oh, yeah. So what I'm saying, what I've not monitored, what the side effect of the lockdown in the South Sudan is all about. What I was saying, based on what I've seen, there is a lot of drug addiction in this period of lockdown that has taken place a lot. Young girls and young boys, they've decided to go for that kind of thing. And two, I was talking of
Okay. I think probably until he comes up to talk again, I will keep quiet or shut my mouth. Teenage pregnancy, wow. It has been an issue not only in South Sudan, even here in the Western world. England, until probably recently in Europe, was doing quite fairly badly in terms of teenage pregnancies. I can understand if the number of pregnancies has gone up in this lockdown. Probably if lockdown has happened and people are not able to hustle for food and go out to look for a living, probably parents can force girls into early marriages, or the girls themselves,
network is not okay.
Yes,
It's all right. Go ahead.
Because of hardship, can then go on to get themselves partners or get married. This can happen. I think I can identify, or I can understand where he's coming from. I very well can I understand. And also because of idleness, if there is plenty of drugs going around, and that again can happen. In this country now, we have something called chemsex. I don't know whether you guys have heard about it. Chemsex is happening. People take drugs to have sex or to take away the shame or the numbness in order to have more pleasure, or to inhibit that sort of to inhibit them from doing what they wouldn't have done if they were not high. So I do understand where that is coming from. So yes, go ahead, Caesar.
Can I make two observations for Caesar, maybe to address if he has the opportunity? I wondered actually if, I don't know his profession, but if from the medical profession in Southern Sudan, whether there is possibility that lockdown also excludes these young girls from maybe contraceptive services that could be available, because if you lose access to that, then of course you will get another spike in maybe teenage pregnancy. I'm not so sure this is the case, but it's important to appreciate. If on the other hand, that is not the case, still, I would actually be very wary that after the child is born, or even for the regular families that where the maternity care has been impacted by lockdown, because I know in the case of Uganda, you need a receipt from your local council, I think, to be allowed to travel during lockdown. So all of these things will impact. And one is maybe normal care for the unborn and then the newly born. The other is actually what is the trigger for these teenage pregnancies. I think it's an important thing that we have the same problem we were discussing in our community forum in Uganda today. So maybe you can relate to some of those if you've got some information.
Yeah. Clearly, one problem causes another. Go ahead, Caesar.
The question
Can you hear us?
I don't know whether you heard the question.
I wondered what is the best way.
He's talking, but I can't hear him. Hello, Caesar, can you hear us?
Yeah. So he has gone. But I think for us, I think it might even be useful that if we follow up with some like question and answer service, maybe over time in the follow-up week, some of these things can be addressed. It's really important a healthcare professional at home to give us some assessment how anything like contraceptive services or maternity care are impacted, and how this will change between first and maybe second lockdown, if at all. Because if there are lessons that have been learned already, maybe a second lockdown, if one arises, you actually cater for this kind of services, because these are the pinch points of the healthcare delivery. There are certain things that can wait. Maternity cannot wait, and if an unexpected pregnancy arises, the way in which that is going to be managed must be an immediate thing. So somebody probably from home will be able to inform and help with that debate.
Yes. Again, probably discussing on that, the question here would be, if there is an unwanted pregnancy, does the society or does the community condone termination of pregnancy? That's one thing. If it is not something that's condoned, then this young teenager is left with this unwanted pregnancy to either go through the pregnancy and have the unwanted baby, or go ahead and do clandestine sort of termination, which may result into their life or their consequences are met. So there's a lot of issues going on with this kind of thing. I mean, personally, I don't know what the requirements or the arrangements are in the
I think without making a judgment, Marcelina, I understand that perspective, and it's important. What are the traditions? What would be the wish of the family? But I think what in a situation like lockdown is unmasked is that there might, in the life people live, have been opportunities, things that happen that we don't know. Bringing lockdown, it comes to the fore, because the opportunities they might have had to be it clandestinely or with the tacit support of an embarrassed father, let's say, allow an abortion. These things during lockdown cannot happen. And I'm not so sure that it will be the numbers that are seen now, but I think given that we're in this kind of conversation, we should actually bring these thoughts in the minds of people, because we've got sociologists, we've got people who will go do research, and I think it's important these possibilities are explored. We don't know. I mean, we've got many religious people or with very strong cultural beliefs. The expectation is that termination of pregnancies is not the norm. It's not the first thought. But nevertheless, we've got a lot of our young people who are living in a modern, let's say, a modern lifestyle. A lot of them have access to the cities, and you don't know how different they are to us, for example. So if anybody is going to be addressing issues like teenage pregnancy, you have to be aware of how much society has changed. Not even just between when we were at home and now. You think before, during, and after lockdown, there may be a dramatic flip of the situations exposed us and risk-taking behavior, and also the other pressures that push them into that. I think those are important things that I wish we had our colleagues from home discussing it with us.
Yeah.
I don't disagree with that, but the problem here is the society in which we're living now does not empower the youth. Even if the youth is empowered, the facilities are not there. You could empower that youth to make that decision in the modern, in the context of the modern setting. They are empowered to take a decision whether to use contraception or not, whether to go for termination or not. But the facilities are lacking in the country, and the support network is lacking. That is where we are coming from. I mean, if that youth sat in this country, they can be supported with that decision to do what they want to do without even the father's or the mother's consent. But in a setting like back home, it's quite difficult. That is where the challenges are.
Yeah, can I put another scenario in our minds? Let's say that happened between two, let's say, reasonably respectable family, and even if it was clandestine, would you put it beyond them to send that girl across the border and find a way of doing this? Because I think there would be families who could still do that.
In my view, it seems that, with the lockdown, there are other services which the government need to provide more of, because the lockdown brings idleness, and what does idleness do? It causes people, from Caesar's perspective of what we were saying, young people to go on drugs. And when they go on drugs, they do things that they would normally not do. You find a lot of pregnancies happening now. So maybe what our government should concentrate on is to do a research and find out the impact of the lockdown, of the first lockdown on our people, and to use that information to develop services in case there's a second lockdown. And even if there's no second lockdown, we know that coronavirus has come to stay. And because it has come to stay, then we have to change, we have to improve, and we have to provide more of certain services that we haven't been provided. It is time, as Caesar said, a lot of awareness should be done, not only to the community, even the people in the professionals. They need to be aware that these services are needed more than those services, and funds should be channeled towards those services. That's my take.
But can I just ask you, Caesar, how long was this lockdown in South Sudan, and was it really effective? Did people observe it to the letter?
Hi, Caesar.
Okay,
No.
let me address that by not answering because I don't know, but I think it's important. I think something that was in my mind, what I wish Caesar was there to I hope he can hear me. Something I would like us to be able to do is we have the same issues.
Now I'm getting you guys very clear, very clear, very clear.
Okay.
I'm getting you very clear, very happy.
Please,
Maybe
please.
he should come before he disappears again.
Don't run away again.
I was looking for a place where to get you guys clear.
Okay. Can I just ask you,
Yeah.
how long was this
Yes.
lockdown in South Sudan, and was it observed to the letter? Was it observed?
Sorry?
How long was the
Come again?
How long was the lockdown in South Sudan, and was it observed?
Well, I believe since the lockdown has been there in March, since March this year,
Until
now
when?
let's say down 4 months. Well, it's not known because on the 9th of August, the president was talking of we should allow ourselves to live with the coronavirus. So it's like we have to accept to live with it. That's what he's trying to make about it. But my worry is of what I've seen in Nimule and other part of Eastern Equatorial states, particularly in South Sudan, people are ignorant about this, despite the fact that a lot of humanitarian aid agencies and NGOs are helping in and out in the collaboration with the Ministry of Health. But I think it's not enough. Most of us who have to put in mind that we need a lot of effort to fight this issue of lockdown, and then to give an awareness about this. Another point that I've seen so much, I was not so clear to you there, that I've observed, which is existing here in South Sudan, is the high rate teenage pregnancy of school drop-up of girls, and then forceful marriages, commercial sex work, and drug and alcoholism, especially particularly in the border where us being busy every day. Nimule is receiving over 300 to 500 trucks that are in and out. The rape cases that has taken place at Elegu border, where most of girls who are coming from Uganda to their parents inside South Sudan, most of the cases has been registered by the police. And
Yeah.
due to
Can I
lack of
interfere?
no schools,
Excuse me.
the peer groups. Yes, please.
Yeah, is that particularly during this lockdown time,
Come
or
on.
is it something that has been going on?
Not clear.
I said,
Network is fading.
okay. I said, what you're describing now, the
Hello?
increase in, yeah, hello. I said, what you're describing now, the high pregnancy rate, the drug addict, the sexual, sex trade, and so on. Is it happening during this period of lockdown, or is it something that has been happening before?
Mother, you're not clear.
I
Caesar,
said, yeah,
You're not clear.
okay,
That's the
Caesar,
difficulties of network
Caesar,
as before.
Caesar, what you're describing, is it due to the lockdown of coronavirus?
okay. I would like to
I'm not
apologize.
hearing well.
Okay, it may well be that what you're describing has been either due to coronavirus or it's been made worse because of coronavirus. We are more interested in knowing whether what is happening is as a result of the coronavirus.
Oh yeah, all the observation that
Go on.
what I was talking about is all the experience that I've monitored during this lockdown of the coronavirus,
Okay.
Due to so many things, because of the lockdown, so many activities has been turned down. Other people have lost job because they cannot sustain. So these are the effects that I saw from the lockdown of the coronavirus. I thought I was expelling what exactly I've seen and what is taking place here in South Sudan. Because most people have lost job, others are not working, and they resort to all those what I was talking about.
So do you, in your opinion, should we continue locking down or do you think we should open the place
And
up?
as I talked, now here, due to the lockdown, there are a lot of issues of divorce within the families. Because you found a man cannot sustain. Sorry?
Oh, okay. So do you think we should continue with this lockdown, in your opinion, or do you think we need to open up for people to survive? I think, Dr. Lily, what is your take on this?
I would have liked to say something for him to listen to, but here we are. I will say it anyway. My feeling is this: he has gone and done a survey research during this time of lockdown, and he has flagged up those issues. And I don't think we can push him too much to say how much has it changed. But my feeling is this: I think these are ills in society that were always there, but the COVID-19 lockdown has made it worse. That is my impression. Because if you think about it, we have all those trucks that were being held in Nimule before they could go either way. The crossing they used to do in one day, it might take them a few days. What do? They linger around. And what is their encounter? What are the activities that involve? So I think the lockdown made things worse. But the ills that are being highlighted are ills that are like in society, they would normally be there even without lockdown. And come to talk about the rising cases of divorce, we have the same here. people talk about how families are falling out because we are all kettled in one house, and it's not easy because we are normally you let off steam by being at work and other activities. Your social interactions actually help, but in the one house, I think people always have those difficulties. So it's not just in Southern Sudan, and I wanted him to
Yeah.
also hear that because it's happening here as
Yeah.
well.
Yeah. Thank you so much. Can I just
Violence also right.
Can I just 1 minute? Can I just say this? We have now. I just want to apologize to our audience out there. We've had a lot of network issues, but we're here. We are here at the show. If you could join us, give us any comments. We are way over half an hour now, so we are close to coming to the end of our show. And our show this morning or this afternoon is about second lockdown. Is it going to happen? And if it happens, what will happen to us? So I would invite you with any comments, any questions for us. Thank you. We're going to go ahead now. Yeah, come, Marcelina.
No, I was trying to comment and say that domestic violence will also be rife in connection to this lockdown as well. Equally same because of the being locked down or being locked up with the same partner whom you cannot let the steam out, as Dr. Frednat was saying, always in the same vicinity or proximity with that person. So there are a lot of things that have happened in this lockdown. In as much as the economy of the country is coming down, personal economy is coming down, it is really affecting us in our social being. Human beings like socializing. So if now all of a sudden the social beings we're having is just children, husband and wife, I think it's also quite detrimental to our mental health. When or if in that relationship you were just about tolerating that person, that tolerance level I think becomes zero. I mean, whether it becomes non-existent, and things really go completely the opposite of what we expect. So whether a second lockdown is going to happen in this country is difficult. I just to determine at the moment. But I just want to ask Ferdinand on a case, or to look at the case of Manaus, that city in Brazil.
Which country?
The city in Brazil, Manaus.
Yeah.
Manaus never did much. Manaus now is not seeing any deaths. The doctors or the healthcare providers have now are becoming jobless. From having no oxygen, ambulances had nowhere to put people, had no places, no vacancies. All of a sudden, the death rate is zero, the excess deaths are not there, things have improved. Although it's said that you need about 60 to 70% to acquire that collective immunity, it's said that they haven't even reached up to, I think, 20% of cases for them to have that collective immunity. What do you think has happened?
In my mind, when you pose a question like that to me, I'm thinking about writing a project. What is the question I would want to answer? I think there will be an underlying vulnerability that is distinct in that population compared to others where you think it should be 60%. Those are populations that have been exposed to different types of viruses, diseases, and for those reasons, immunologically, there may be a population that only need 50%. Not 60%. So those are the unknowns. If I were to do a project to try and find out why their death rate has dropped, I will try and find out is there an immunological difference between that population and the one which gives us that figure 60. Because I can bet you the figure 60 didn't come from around. That would be my immediate reaction.
Okay. But do you think realistically we will go on, sorry?
Yeah, I would think also because, with the current situation, people are reading more and people are taking care of themselves much better than before. The recommended like the vitamins, people are taking the vitamins and people are eating healthier you eat. the more you become, you can defend your body from diseases. So I think people's behavior has changed, and aside from the collective immunity you're talking about, that's my take. Because if you behave better, if you don't do the things you're told not to do, I think you will improve. But of course, what I don't know is whether it is the collective immunity or isolation. I don't know if these people are isolating themselves because you said there was no lockdown, isn't it? So it means it is the collective um, immunity. So with their collective immunity and also with looking after themselves, I think that has improved the status of Brazil.
The other thing I would say quickly is that if there was something like, for whatever explanation, if nobody took any action about this disease and it went through every country, the survival rate would be different between countries without any intervention whatsoever. Let's imagine, let's have a mental experiment. If you have no intervention whatsoever and you let this disease go through the whole of the world, the survival rate will differ from one country to another, which means whatever lockdown or other intervention you have, the outcomes should differ because the innate resilience to this disease differs between populations. We don't know why. I think that will be part of my answer.
Which is very true. But then that makes me ask as well, do you think we really need a second lockdown in this country?
Well, I'll put it this way. I think whether we need a second lockdown, my view is this. We have got a certain experience. So we either, if we find ourselves in a very vulnerable population, we might need a second lockdown because we're making a judgment between the value of human life and maybe the economy, because it's a balancing act. But more likely, if we're smart enough after our first lockdown, we should probably do local lockdowns by small outbreaks or by virtue of sectors of the community or businesses. That may be the smartest thing to do. If you find that it is spreading in a hospital, of course, you lock down a hospital or do whatever you've got to do, or in a care home. So there will be either those outbreaks in terms of local lockdowns, but not like the generic second lockdown for the whole country, or a smarter way, you lock down different activities or populations. Because one thing I didn't have an opportunity to talk about is the outbreaks have more to do with the activity than individuals. Because if you've got a group of youth in a discotheque, they will all get it. But if you've got a group of monks praying quietly in an open space, even one of them may not get it if only one of them has it. The rest will not get it. So it's the activity, not not the people. So we have to be smart about the next lockdown.
I think personally, yes, I am in favor of regional lockdowns or area lockdowns or city lockdowns as to the whole country locking down. And that would then take me to posing a question to ourselves. If we were to be the decision makers, or if we were to project this to our various countries, South Sudan or Uganda or Kenya, currently, how can we do this? How can we advise our countries to do this, given the fact that we've heard what we've heard briefly from South Sudan? How can we really advise, or how can we go about this? Can you take on this?
I'd say the first thing is to decongest the cities. And I would go back, let's say 50 years and say kids, primary school kids can start learning under the trees for very good public health reasons, not because we're poor. And then you find various ways and tiers of trying to do that. Because if you got to a level where from like secondary school to university, if they can have a little more of online learning, then give them those opportunities, because that is the best way government can investment. Because when the economy closes down because of lockdown, the government has no capacity to help the population. So we need to find a balance. What are the easiest things to do? In the rural places, we always used to get very little from the government anyway. We can even take that one step further. Hopefully, in good weather, kids can learn outside. And they're told if it's raining, you go back home or something like that. Because that used to happen in the past because we were poor. So we should think step by step. What are the things that we can ease away from?
I think so. Yeah, I think that's quite a good suggestion, really. It brings us back to the talk we had previously, isn't it? When we
Yeah.
said we can still carry on our activities and not bring down our economy because we've got the open air, and the open air allows us the social distancing, which is the 2 meter. So if we're going to our shambas to cultivate, you can sort of do the 2 meters, isn't it? And the 2 meter is quite, and in an open air as well, can allow you to cultivate, can allow you to do your activities outdoor without necessarily exposing you or putting you at risk. So the economy can still go on, and livelihoodness in the communities, in those communities, can go ahead. So these are the kind of things, really, I think our governments or our local governments need to look at, so that we don't completely shut down if we need to do a second, or we need to implement another lockdown, which may be local or which may be city by city, really.
In fact, I think about this lockdown mainly as a city phenomenon, and nobody really should have any basis to touch the rural farmers. Leave them well alone. They always survived in spite of our government. The government knew about them because they had to pay poll tax. Now you go to the city, you should actually do the engineering of social distancing and everything from the city. You begin by decongesting. If you are cutting down on economic activity, people like the borders, in my opinion, should be given less and less raw. They may be very handy in dropping food parcels, but you should have fewer of them. They should be not carrying passengers, billion passengers. And now those taxis, one should find a way of how can we help people who cannot do without those kind of transport. The government should do those things. University students should find ways of learning. Try the big parastatals, give them the opportunity for corporate social responsibility to provide laptops to university students that are locked only for learning. And that way you can cut down the level of activity by way of travel. And that will take us through the supposed second lockdown.
You know what? I have never been of the opinion of locking the rural area. That's why in the previous discussion I did say I don't see why somebody who is in the village cultivating should be imposed the lockdown on. Because one household is here, the other one is half a mile away. What does it mean to them to lock down?
In fact, at the very worst case, they are one family, so they constitute a bubble, so they're still okay.
For me, what I see is the lockdown, it didn't happen correctly, especially our lockdown in South Sudan. What happened was they left the trucks coming across the borders, and there was no lockdown for those trucks. They were able to come through, but there was lockdown for the villagers who are cultivating, and there was lockdown for the people coming to the offices, businesses, and so on, which wasn't right. So if we are to implement the lockdown correctly, what would happen to the trucks? They are bringing in food, what would happen? Unless our government turns around and encourages our people to cultivate a lot so that to be self-sufficient instead of getting the foods coming in from the neighboring countries.
It's not only that, there's a lot of money exchanging hands. If I brought a truck and I get to the border, or I got to the border and I'm not checked, or for some reason I managed to clear somebody very quickly, I will find my way into the town without even anything happening. There's a lot of things happening. And these are the problems that are coming in and out of the borders, whether it's my side or the other side. And these are the problems we're facing.
We should also watch that we still live in a cash economy. Cash passing hands. You don't know how many people handle the same banknote.
There's a lot of exchange, yes.
If I was going to do a research there, I would keep swabbing the banknotes to find if there's COVID. I shouldn't scare people too much, but at least they have to be aware that they should minimize all of those activities.
Yes.
Wow, that's fantastic. I think we are now into the end of our show. It's very interesting, but we can't take the whole day. So we're going to wind up now.
Just before we finish, there's somebody, just before you summarize, somebody sent a comment.
Yeah.
They said, I commend all of you active panelists for the good educative work and deployment. And sorry too, really,
Appreciate it.
Yeah.
Appreciate it. Namanza Kwasi.
Yeah. Thank you so much, Dr. Rianza. We are grateful. We are thankful for that. Okay, and okay, we are now coming to conclusion. So I'd like to ask the panelists, what would you take home with you? What is the message you want to leave with our people this morning or this afternoon? Lali?
I think what I'll do is I'll just go through this idea that, okay, second lockdown may come, but we've got to be smart as individuals and as a government, because if it has to happen, you have to have a reason. Ideally, a local lockdown because there's an outbreak, or maybe a certain sector of community, of the population, of the economy, because it poses a particular risk. Apart from that, the people in the rural places should continue their farming, their subsistence, because they will do very well as long as they don't live in the city.
Thank you. Dr. Marcelina?
Yes, I think we have learned from what has taken place in the past since this novel coronavirus has been in the play. So we should learn how to, or we should continue to take care of ourselves very well to avoid any further lockdown, because these measures are brought about if spikes or if more infections take place. And therefore, we should really, really take care of ourselves to avoid this. Back home, let us please try and observe what is best to keep us safe. And let us also bear in mind that we should allow the economy to boom, whether it's in the rural area or in the cities, by still trying to keep safe. Because this coronavirus is going to be here for a bit longer than what we expect.
Thank you so much. And for me, what I'd like to say is the second lockdown will only come from our behavior. So let us watch how we behave and let us follow the instructions very carefully, because if we don't follow instructions, if we get a second lockdown, we are all affected. And we don't want that. Our economy is failing. Our children are having a lot of gaps in their education. We are not reaching our targets. We cannot socialize. We cannot do the things we want to do when lockdown happens. So please do follow instructions and do listen to your government, whatever they tell you. But most importantly, use your common sense. Thank you so much. I hope you enjoyed the show today. See you again in 2 weeks' time. Bye-bye.
Bye-bye. Bye-bye.
Bye.